Next presenter is Dr. NEENET Jose, Ocular Trauma in Pediatric Age Group, Predictive Accuracy, Pediatric Penetrating Ocular Trauma Score.
Good afternoon, everyone. The title of my study is Ocular Trauma in Pediatric Age Group, Assessing the Predictive Accuracy of Pediatric Penetrating Ocular Trauma Score. 20 to 50% of ocular injuries presenting to hospitals occur in children. In children, delay in presentation, unclear mechanisms of injury, and poor cooperation with eye examination can make the initial assessment less accurate. Thus, a precise visual prognosis is a challenge in pediatric cases, and long-term recovery can be complicated by amblyopia. The ocular trauma score was put forward by the Ocular Trauma Classification Group in the year 2002. They also put forward a probability index. Using this probability index, the clinician could accurately prognosticate the final visual outcome with 77% accuracy. According to this prognosing system, the initial presenting visual acuity is regarded as the most important parameter that aids in the prognosis of the final visual outcome, and globe rupture, endophthalmitis, perforating injury, retinal detachment, presence or absence of RAPD are other parameters. But in children, as we know, it is often difficult to assess the initial presenting visual acuity and RAPD. Hence, in 2011, another prognostic system was developed by Ekar et al., known as the Pediatric Penetrating Ocular Trauma Score. According to this system, the initial presenting visual acuity is given less points, and in case the initial visual acuity is not available, the formula 2 into age plus zone minus the corresponding pathology is used to instead of the score for initial visual acuity. The age of the patient is taken into consideration, wound location and concomitant eye pathologies are taken into consideration. The aim of our study was to evaluate the predictive value of pediatric penetrating ocular trauma score and the final visual outcome in children with open globe injury. The secondary objective was to compare the correlation of OTS and POTS on the final visual outcome. It was a retrospective observational study done on 36 patients. The records of children aged less than 15 years who presented with penetrating eye injury from January 2022 to June 2023 were analyzed. All patients were reviewed on the basis of age, gender, time of injury, mechanism of injury, time of admission, time of surgery, type of penetrating injury, initial visual acuity, final visual acuity, and concomitant eye pathology. OTS and POTS were calculated for each of these patients. In our study, around 50% of patients were less than 5 years old, 41.7% were 5 to 10 years old, and 8.3% were above 10 years old. In our study, we could find a slight male preponderance. 70% of the patients were males. Both eyes, right eye and left eye, were found to be equally affected. Most common cause of injury was with sharp metal objects. Complications like iris prolapse, hyphema, traumatic cataract were found to be common. Most patients received surgery within 48 hours of the injury. Complications like vitreous hemorrhage, retinal detachment, and endophthalmitis were found to be rare complications. The initial visual acuity, as expected, could not be assessed in around 52% of the patients, and final visual acuity ranged between 0 to 0.2 logMA units in 47.2% of the patients. And upon analysis, we found that POTS correlates well with the final visual acuity, whereas OTS did not show any correlation. Our population of the pediatric globe trauma were similar to other reports with a slight male preponderance. Our study supports the hypothesis that POTS may be superior to OTS in pediatric population in terms of predicting the final visual outcomes. Studies conducted by Avidi et al. And Zui et al. Also support the same hypothesis. A larger study conducted by Shah et al. In 124 patients stated that POTS was found to be more suitable for low-risk injuries and has low predictability in high-risk trauma cases, and that OTS is better in high-risk cases. Conversely, another study by Chowdhury et al. Found that OTS is a reliable predictor of final visual outcome both in blunt and penetrating injuries, and POTS shows gross underestimation of the final visual outcome. Our study had many limitations: small sample size, short follow-up duration, inability to formulate a probability index, difficulty in actual quantification of presenting and final visual acuity in pre-verbal children. All these were limitations of our study. So in conclusion, POTS can be a reliable prognostic tool which can aid in a better communication of prognosis. OTS was not found to be a reliable predictor of the final visual outcome. Our study is limited in many ways. Hence, a large-scale multi-institutional study into the use of pediatric ocular trauma scoring system is necessary. These are my references. Thank you.
I think all the questions we wanted to ask, you have put in the limitations. Thank you. Okay.
Thank you, sir.
You cannot conclude if you are not able to check vision for half the bone and half the visions.
Yes, ma'am.
Limitation. Thank you.
Thank you.